Hello, everyone. My name is Chuck Hamilton, and I'm the Chief Innovation Officer at Mshaped. I'm also an executive advisor and partner with InoCrowd. And recently, Soraya Gaddit asked me if I would collaborate on some best practices, tools, and other supporting systems I'm seeing being used here, maybe in North America and Canada specifically, and things that we could better share across different organizations and across different companies and geographies. And the notion here is that while there's so much work going on everywhere to try and curb the COVID-19 virus from spreading, everybody's maxed out and doing as much as they possibly can. But the amount of sharing of best practices, who's doing what, what's working where, what things we're seeing, that's hard to share even within a given geography, let alone through multiple geographies. So I thought I would start to do a collection of things I was seeing and just pass them on in the spirit of sharing so that Soraya and team could use them perhaps in a different way. So I gathered up four categories, and I'll show you them over the next little while. We'll talk about them. But basically, it's a bunch of curation of a bunch of tools and more system thinking. The way I started with it was figuring out we already know what's working well and is repeatable. So, for example, planning for and scaling of our health networks and systems is what everybody is doing. Rapid, wide-scale testing is what everybody's trying to do, and each jurisdiction, no matter where you are, needs to be able to do that. We're also hoping for and trying to improve upon the messaging, and we're always looking for clear and consistent messaging from our leadership. And that's not always the case, but we're hoping that through consistent messaging, people do the right things, practice the right work they have to do. And then, of course, all the stay in place orders, social distancing, and restricted movement activities are all proving to work and have worked in other geographies. And of course, everybody's applying them in all locations right now as we all stay at home and try to work things out. Underneath that, there are four other categories that I kind of think are real interesting areas of collaboration and spaces where we could be sharing more. And so I've divided those up into testing, traceability tools, virtual work, and virtual communities and social action networks. And if I had a fifth here, I would probably put in a fifth box for just acceleration of manufacturing and different manufacturing practices and the speeding up of the manufacturing process overall. So we'll go through these one at a time, and I'll give you some insight as to what I think we might be able to share more in each one. So under testing, both rapid and scaled testing of existing COVID-19 tests, there are just really a plethora of testing tools and products out there, and people are doing a lot of things. Ones I've seen and heard that are being reused here are the Spartan Cube. You can look at it through Spartan Bioscience. Alberta is one of the provinces that's using that in rural areas, but I think a lot of provinces are going to be using that in a lot of places across Canada. The BTNX rapid blood test, the 15-minute test that a lot of people are seeking. There's one based out of a company in Markham, Ontario, and they've been shipping it to the US, in fact, for their testing purposes, but it is yet to be widely deployed in Canada as far as I can see. And that's just a approval process problem, I imagine, because there's a lot of people lobbying to get it done. And then there's this whole database of activity around testing. And if you look at the database and look at all the data and all the stuff that's coming in, it's a really valuable resource to understand how we're testing, who's testing, how much they're testing, what is the sort of impact of the testing, and all of that data that's being collected at this particular site. And so I've shared that with you so you can look at more of that kind of activity. Traceability is all about understanding where you've been, if you had contacted the virus, possibly where you contracted it, and then where you were since you've contracted it, and basically tracking your movements over sort of a period of time. And the biggest project of that ilk was probably done by Singapore with their Trace Together product, which they had hoped to kind of make as an open source product, which I think may be out there now. It's already been downloaded by about 1 million people, and it's got mixed reviews, but it suggests that it needs even more people if it's going to be successful. The second one on the list there is Live Now, which is a company out of Silicon Valley, which has a tool set for tracking and understanding the traceability. And, they argue that you can stop it in its tracks if you can know where it started. And so they're trying to get more and more adoption of that Canada-wide. In the category that is virtual work, there are just really way too many tools to think about, including all of the collaboration and meeting tools which you see at the top there, for everything from Microsoft Teams, Zoom, Google Hangouts, Ring Central, Slack, and many more. There are really a whole bunch of tools, and it's really kind of the entry layer, if you will, of collaboration in a virtual way. The other tool I kind of highlighted here is self-assessment tools. There's a couple of them out there. The one from BC, self-assessment tool, is being rapidly deployed across Canada now to be able to do self-assessment early. So basically, answer a few questions, and if you answer those questions correctly, you'll be able to understand whether or not you need to go to a doctor right away, or go to the hospital and or call 811 and then get further direction from there. It's a valuable tool to kind of get people doing it, and I think there have been millions of people on this platform doing self-assessment. Then there's this whole category of what I call virtual doc, or telemedicine, virtual clinic tools. There's really, again, thousands of these to be able to consider. Probably, maybe you can narrow it down to sort of a top 20 in the category. One that's in use in Vancouver I know about is Akira, and it's sort of a healthcare on-demand tool. And it also does mental health coordination connection, which can be valuable. Then Maple, which is another Canadian one that's being used for virtual health and virtual prescription across Canada. One or two actually that I'm working with through the Venture Labs site include the Medimap, which is managing the whole walk-in clinic process, managing the lineups virtually so you can know when you could be a better time to go down than another, and then hooking you up with virtual kind of diagnostics and a virtual doc after you've booked a clinic time. So again, you can do a lot of that over the internet. And then Agrity is a tracking tool for people with COPD and other related respiratory diseases, and it tracks them again over time, so that when you're going into a situation, you can know whether the people there have had or do have a pre-existing condition, and tracking that in a good way. Some of these are very, very sophisticated tool sets. Cloud DX, for example, which is on there, which is a Canadian company, has a complete test environment, diagnostics for a virtual doc, including a virtual test kit that'll take many biometrics from you and plug right into a USB port on a laptop. They've got a cuff that'll get your blood pressure, and the oxygen testing tool. There's a whole bunch of others, including temperature and other things that they can gain from you. And again, put that over the doc to a doc virtually, who can make some assessments of what you want to be able to do. I've even seen some cough analysis where you cough into the screen, and it analyzes the cough and then compares the cough to other coughs, and then tells you what kind of cough you may have. So I think that is really interesting technology overall. And then at the bottom of the list there's a whole bunch of equipment and related delivery stuff. Mobile ventilators from Moves SLC, which is another Canadian company near Toronto. And they're rapidly trying to build as many mobile ventilators as they possibly can. These are all-in-one ventilators, and really change the dynamic there if you can get enough of them out. High speed or high availability power supplies that are mobile and can recharge on the go. These are really valuable resources right now, and people are taking a look at how they can use those. And then you've got drug delivery systems like drone and kind of community drug delivery. There is we did the first drug delivery here in BC in Canada, and it's a drug delivery by drone. And I think we could do drug delivery by drone. We could do drug delivery test kits. We could do a number of other things with that same kind of model. Okay, moving on. So now when you were talking about social action communities here, and this is a really powerful tool set that's not being used as well as it could be, but is easy to share. One of the ones, the top one on there is Curatio. We work with it here in BC, and they've grown across North America. And basically, it's a patient support network where they match people up with similar concerns or difficulties and put them into a network where they're helping each other and connecting and working together. You can also put a doc in the middle of these groups and so on into the social network. So think of it as a social network, your private social network for health. And that can be very, very valuable. There's a huge mental health component to this, and a number of other get help and resource kit from your neighborhood and or from a community as large as it needs to be. There's some really great action groups like the open source COVID-19 medical supplies group, which is creating all kinds of medical supplies from a maker community across the globe. And there are maker communities growing all over, creating everything from protective gear to masks of all sorts and different ideas. From a software point of view, there's an open community for collaboration at the GitHub location, and I've given it to you there. But it's basically a way to collaborate on projects with shared goals of code or things that need to be done. The Honeycomb community tool is way to launch a small community around almost anything. You can have a community around your work, or community around your neighborhood, anything you want to be able to do. The Slack for COVID-19 group, there's a number of Slack communities around COVID-19. They're not talking to each other as much as they could, but once again, you could set up a Slack community quite easily and pull together a community in a local area or a wider area if you need to be able to do that, especially for professionals trying to collaborate with each other around what's going on in a given area. It's very helpful. And then I listed a whole bunch here of what I call social capital communities. Howard Rheingold wrote a really great piece here called Mutual Aid and Social Capital. And he talked about the power of communities, and he listed a bunch of communities that have sprung up just around COVID-19 to collaborate and do what we do, things like InoCrowd does, where we use open collaboration models to be able to pull ideas of action and help out into the world. And that's a great resource as well for virtual communities and social action networks. And so that's about it. This is me. You can get more information about me if you need to. And my email is there. I'm here in BC, Canada. And again, this effort is just share as many things as you see going on and share them in a way that people can absorb them. So thank you very much, and hope you can use this resource out there.